Can you hear? Ma'am, can you hear me?
Yeah, Namita, I can hear you. Am
Okay.
I audible?
Yes, ma'am. Shall we begin the session, ma'am?
Sure.
You're looking very pretty today.
Thank you.
So, good evening, everyone. Let me say how happy we are that we received your support and feedback throughout this session. We've come to our final session, and it's such a pleasure to see all of you here today. I welcome all of you once again to the national webinar on Chirorogas by Team CAME. Please join me in welcoming our respected faculty, Professor Dr. Roshni Madam, to this session. A few words about Dr. Roshni. A successful and ambitious clinician guided by a right sense of service. She started her career from BAMS from Government Ayurveda College, Trivandrum, and went on to do PG in Samhita and Siddhanta and another PG in Comorbidity from Government Ayurveda College, Trivandrum. Dr. Roshni is presently the professor and HOD at Department of Comorbidity in Government Ayurveda College, Kannur. Dr. Roshni completed her PhD from Kerala University, specializing on childhood autism. With an clinical experience and teaching experience of over 18 years. Doctor has received the Best Doctor Atreya Award in 2019 by the Government of Kerala for her contributions in the field of Ayurveda Pediatrics. And Doctor has also been the Best Implementing Officer of Kerala State in 2019 by the local self-governance department for activities in connection with the Snehadara project, which is the Ayurvedic management of developmental disabilities in children. This project, Snehadara, is a model project in health sector and crucial in receiving the Gram Swaraj Trophy for the best district panchayat in the state level in the year 2017 to 18. The project has also received the Deen Dayal Upadhyaya Panchayat Sashaktigaran Puraskar in the national level in 2017-18. Dr. Roshni has carried out various research as principal investigator in connection with Government of Kerala and the Center for Disability Studies. Another notable contribution is that Dr. Roshni has come up as the first runner-up in National Level Research Award 2010 in the Ayurvedic Management of Cerebral Palsy in Children conducted by Kerala Ayurveda Limited. To add to her, she has also done BLS and Pediatric Advanced Life Support certifications by the American Heart Association. So let me say how lucky we are to have somebody like you with us today. We are sure it will be a very interesting session. Anymore, so ma'am, please take on the screen.
Thank you, Namita. And I'm really honored to be a part of this CAME. I think this is the consecutive, this is the third or fourth time. And I'm happy that this group is organizing very well on organizing CMEs. And an elaborate sketch of or treatment plan of this underlined or specified topic is being covered. So today my topic is Shiroroga from a pediatric perspective. Namita, my screen is visible?
Yes, ma'am.
So I think we had a complete sketch of the Shirorogas from different viewpoints, and today from a pediatric desk. So Shiras being the most important organ, especially the biggest organ in a kid. So it's of much importance, not regarding the usual diseases, but it forms a main checker point for the growth and development of the baby as well. So baby having a good head circumference or head size should be a point of concern of each clinician. So even in the well baby clinic, where we are routinely screening the babies, or when a baby is coming to you at the age younger than 5 years, routinely, as a routine, every clinician should have an assessment of the head circumference. It's not mandatory that you should measure the head circumference with a tape, but you should have a look at the head size and head shape in every condition, because the head size and the shape will be speaking about the neuronal development of the baby. Either the baby will be having some eating problems, or the baby will be presenting with headache, or baby will be presenting with vomiting, nausea, indigestion, reduced appetite, constipation, anything. But you should have a look at the head circumference, head size and shape, because the neurological manifestations or neuronal axis development can reflect as any systemic manifestation, because an underdeveloped brain can manifest as a behavioral abnormality. The child may be hyperactive, the child may be having a reduced aptitude towards study, child may be having constant indigestion, or appetite may be reduced, his growth parameters, height and weight may be reduced, he may be presenting with a headache, or you can expect a wide range of presentation with the reduced neurological axis. And it should be noted that even a seizure can present as a headache. So the first and foremost thing I want to stress in this presentation is that please see the size and shape of the head. And we should be thorough with that, what is a normal expectation. So at birth, every child is expected to have a head circumference, which is measured. I think I kept a figure showing that how we can measure the head circumference. The tape should touch the external occipital protuberance and the glabella, and you can measure it with a rough measuring tape as well. At birth, the baby should be having a head circumference of 34.5 centimeter, and with a relaxation of 0.5 plus or minus. And see, the head circumference enlarges to 4 centimeter in the first 2 months. And I kept a mnemonic to remember that for every next 2 months, the head circumferences will be enlarging like 4 in the first 2 months. Next 3rd and 4th month, that the other 2 months, the head circumference will be enlarging like +3. Next 2 months, that is 5th and 6th month, +2, then +1, +1, and +1. So it's easy to remember. So baby aged 2 months, after completion of the 2 month, the head circumference will be 34.5 plus 4, that is 38.5. So after the completion of 4th month, 38.5 plus another 3, that's 41.5. Similar, it will be that. So first, as you all know, the first year will be is characterized by the remarkable enlargement in the head size, and so naturally the brain or neuronal matter will be having its maximum growth in the first year. So we call it as the golden year. So any treatment area, any external additional care in the form of Murtadaila or Shiroleba or Tala or anything which we do for the head or which we do through the head can have a positive and a negative effect on the neuronal axis in the further years also. And it should be noted that this head circumference, which is 34.5 at a birth, is expected to reach 46 centimeter. That is a net gain of 12 centimeter in the first year. And it should be noted that in the other year, that in the second year, this head will be growing only 2 centimeters. That is 12 centimeter growth is expected in the first year and only 2 centimeter in the next 1 year. and only 1 centimeter in the other year. That's under from second to third year, it's only a gain of 1 centimeter. In the coming years, you can expect only a 0.5 or 0.25, and it will be reaching the maximum of 50 to 51 centimeter by the age of 5 years. And your head won't be growing after that. So you can't expect much improvement in your neuronal axis after the age of 5 years. So addressing the neuronal axis improvement, any deed under the age of 5 years is very important. So I think this mnemonic is very easy to remember, 4 plus 3 plus 2, or you should remember that at the end of 1 year, the baby should be having a head circumference of 46, at the end of 2 year, 48, and by third year, it's 49. So any reduction in the head size is usually, or 90% of the cases, reduction in the head size is always pathology. In very less than 10% of the cases, I have seen that there is a familial asymptomatic reduction in head size. The parental head size will be reduced, and so naturally the kid's head size will be having a reduction, but they will be asymptomatic and normal, and so naturally their kid will be having a familial asymptomatic microcephaly. In all other cases, this microcephaly or reduction in the head size is always indicator of a pathology. So I'm not going into detail because it's not a matter of, usually not a matter of general practice. So another case is macrocephaly. So macrocephaly is increased in head circumference. It's usually an acute condition, and increase in head circumference is usually associated with something, some pathology in the skull bone, or some pathology in the brain parenchyma, or else regarding the CSF in between. So I think you all are familiar with the increased CSF circulation obstruction and everything regard in connection with the hydrocephalus. Again, which is not a common disease, so I am not going to go into details. And another condition which is associated with macrocephaly is achondroplasia, which I'll be showing the picture in detail. And thickening or widening of the skull, again, see the thickening or widening of the skull is again a feature of rickets, which is not an uncommon disease. Vitamin D deficiency is very common. It's very prevalent nowadays. And the prevalence is showing an alarming increase with this, in the last two years due to this COVID restrictions and all. The kids are supposed to be inside the home, reduced sunlight exposure and everything. So vitamin D deficiency has become a very prevalent, and it's again associated with widening of the skull, especially noted more in younger ages. See, this is a case of hydrocephalus. You can see the sun setting sign. This, you can see the sclera above the cornea due to the increased CSF pressure. Again, this is after first course of management. Now the sun setting sign has vanished. Again, I kept a picture just to diagnose the case of hydrocephalus. Another case of achondroplasia. He is a famous film star from Malayalam film industry. This is disproportionate dwarfism is the main feature with a big head. See the big head size in comparison with his and then the girl who is standing beside him is his daughter. See the comparison with the head size. It's a big head and short extremities. His trunk size is also not abnormal. If he is in a sitting position, his trunk size and head size is okay, but extremities are very short. You can see this hand, it's very short. We call it as rhizomelic shortening. And only to note that disproportionate dwarfism can also cause a head size. This is not an area of concern. We are coming to our area. Again, and thalassemia also shows a widening of the skull. See this picture. This is a kid, normal, school going. I don't call her normal. They're reporting in the OP, normal school going, no other issues. They are complaining of aching pain in the calf muscle, especially during evening time. after a play or like increased physical activity. Usually when she's having the attitude of playing in the school, and after that evening time and especially during the night, she will be crying like anything, and she'll be complaining of aching pain on the lower limbs. We call it as growing pain. Usually, I think many of you have encountered it in the clinical practice, aching pain in the lower limbs, which will be subsided or will be relieved with a bit of pressure massage and all. And no other complaints were reported. That was a major complaint which brought her to the OP. And on examination, I found that this is a case of rickets. And I found that on examination, her head sweating was very much increased. Even without an exertion, even while sitting in the OP, I noticed her head was sweating, scalp was sweating. Usually head sweating is a common feature in kids under 3 years, where the metabolic rate is very, very high. But after the age of 3 years, you are not exposed to have a head sweating. If body is cold and you are not having a physical exertion, and your head is or scalp is not supposed to sweat. But especially in vitamin D deficiency, rickets is actually a full-blown picture of vitamin D deficiency. But like minimal picture of vitamin D deficiency is very prevalent nowadays, with an increased head sweating, associated recurrent upper respiratory infections, like it's not upper respiratory inflammatory signs like adenoiditis, running nose and blocked nose. Growing pain, like pain in the cuff muscle, is very common, and they'll be having a bit disturbed sleep. And usually they'll complain that they will insist on keeping the fan on, especially during the sleep. In spite of the blocked nose, they won't be sleeping without a fan. And you can note a thickened costochondral junction. It won't be a complaint by the patient. If you examine thoroughly, you can note a thickened costochondral junction, which we call it as called by the name of rachitic rosary. And you can see a Harrison sulcus, that is a sulcus or a depression underneath the rib cage, and a pigeon chest. Again, it won't be a complaint by the patient. And a bit of knock knee or a bolex can be seen. And the repeated respiratory or GIT issues, again it will be minor GIT or respiratory issues, and again it won't be a complaint by the patient. But you should watch all this together, and along with the presence of dental caries, delayed formation of the teeth, defect in the teeth structure, like you can see pit holes in the enamel, and decreased muscle tone. It won't be decreased in such a level that it will be a complaint usually, but a reduction in the muscle tone will be the usual muscle cramps, then a bit short statured or undernourished. This is the usual picture of vitamin D deficiency which we get in clinical practice. I think many of us will not be diagnosing it as a vitamin D deficiency. And because of the decrease in the amount of sunlight exposure, especially when during this COVID scenario, and due to our cultural dressing style nowadays, or recently, like we usually make the kids completely covered with the dress. Even many schools insist on putting the tie and everything, collar, high neck collar, and keeping the tie here. So the complete full body except for the face is covered. And the exposure to sunlight is very minimum. And that's the main reason. And the rich overuse of cereals having this phytate, especially overuse of this chapati bread and all, which is inhibiting the absorption of calcium. That's the main reason behind this vitamin D deficiency, and the poor dietary intake of calcium and vitamin D. Again, even if we give that vitamin D, which is usually a part of milk contains a rich amount of vitamin D, but you should bear in mind that the vitamin D present in the milk is very hard to get absorbed. So if the baby is not having that much Agni Bala or that much digestive capacity to absorb the or assimilate that vitamin D present in that food, it is going to cause a vitamin D deficiency, which is very common nowadays. It's not that we are not giving a nutritious food to the baby, but the baby is finding it hard to digest and assimilate the vitamin D from that food which we give. So the main reason is Agni Mandya behind and the reduction in the sunlight exposure. And you should also bear in mind that especially the food containing excess of white flour like maida and all, it will be inhibiting the absorption of calcium and vitamin D. Phytates. So again, the difficulty to absorb vitamin D from the milk, which is the main source. Actually, the kids will be habituated to have the milk, perfect milk, one or two glasses a day, which is a very guru ahara. And the milk which we get nowadays is not a perfect cow's milk and all. It's much more guru, and it's if you fortify it like that, make it in buttermilk, that vitamin D will be very easily absorbed, and it is we are fortifying the vitamin D in the milk, and it's converted to buttermilk, and it's getting more liquid. So that in the management protocol, we can advise intake of buttermilk frequently, once or twice a day, and better to avoid the milk intake during that management period. Again, malabsorption disorders like any GIT issues or hepatic issues, and again, lactose intolerance can also cause this vitamin D deficiency. Lactose intolerance is also again a disease having much more prevalence nowadays. So a vitamin D deficiency should be regarded like features like increased head sweating, then repeated episodes of upper respiratory infections, presence of dental caries or delayed dentition, then growing pain, that is pain and the calf muscle or shin bone, especially increased after a physical exertion, and that too in the evening hours. We should keep in mind that it can be a presentation of vitamin D deficiency, and it should be managed that way. So even though vitamin D is deficient, even though calcium is being deficient during this rickets, but we can't find a calcium deficient, or we won't be able to elicit a calcium deficiency during a blood investigation. Why? Because when the calcium level is getting lowered, usually the parathyroid hormone will be stimulated, and this parathyroid hormone will reabsorb the calcium from this bone tissue and supply this calcium or reinstate the calcium level in the blood, so that if you are having a blood investigation, we'll find a normal serum calcium level. But the calcium levels will be deficient in the osteoid tissue. So demineralization of the osteoid tissue is the main feature of rickets, which will lead to fragile or brittle bones or unwanted flexibility to the bones, leading to chances of increased green stick fractures or bending of the bones and flaying of the bones and all. So in effect, in result, this vitamin D deficiency or calcium deficiency will lead to defective osteoid mineralization of the bone, or that is thinning or weakness of the bone tissue. You can see this bead-like appearance is a costochondral junction. I think it's remarkable, but usually it will be unnoticed, or it will be left unnoticed by the parents, and even we don't remove the dress and have an examination if the baby is complaining of growing pain. We'll do an examination only in the lower limb. Again, here you can see the Harrison sulcus and that pigeon chest. This baby will be having a tendency of repeated respiratory infections also. So vitamin D deficiency should be given much importance, and it should be regarded during this routine clinical examination. The main feature will be head sweating after even without a physical exertion. Investigation we should plan accordingly should be vitamin D, vitamin D, D3 in the serum. Then serum calcium can do, but it's not mandatory that it should be low because of the action of parathyroid hormone. Serum phosphorus will be low, and alkaline phosphatase will be a good finding in the biochemical examination investigation, because this alkaline phosphatase can reflect the demineralization of the bone tissue as well. If you have an X-ray, it will speak a lot regarding that thinning of the or demineralization of the bone, widening of the wrist joint, flaying of the joints, and all. X-ray can speak a lot, but even this blood investigation is enough to diagnose a case of rickets. It won't be a full-blown rickets. In a full-blown rickets, I think the prevalence is much less, but mild to moderate degree of rickets is very prevalent nowadays. And how to manage? Management is usually the management from an allopathic desk is usually a supplementation of vitamin D3 and calcium, which I usually don't promote, because it's the child's acne is responsible to absorb the vitamin D and calcium from the food which we are providing. Make sure that the food is rich in calcium and D3, and supplementing a calcium and D3 means you are supposed, or the child's body will be expecting a supplementing expecting the supplementation throughout his life. So it's not the apt way, or it's not the Shuddha Chikitsa. We have to enable the child's acne or child's body so that the acne is able to assimilate even the small amount of calcium and vitamin D3 from the food which the child is getting. So increasing the acne bala, usually the child vitamin D deficiency will be manifesting a Vata Kapacha Acne Madhya. So having drugs like Ashtachurna or Hinkvajadi Churna having a Vata Kapachamana is more effective in management of this vitamin D deficiency. I usually prescribe Ashtachurna mixed with buttermilk. As I told earlier, buttermilk is a fortified, that is a very rich source of vitamin D. It's much more richer than the cow's milk, so it's better to avoid all other dairy products like Guru Ahara, like milk, curd, and everything, and better to advise buttermilk. I usually advise a buttermilk with bit of ginger and curry leaves, so that the acne dipti is again made a bit more fortified, and a bit mix a bit of Ashtachurna along with that buttermilk. Or you can either mix it honey as well twice daily before food. And while we are giving this buttermilk, and especially during tea time and all, better to avoid any other snacks containing phytates or cereals along with that. So especially these biscuits and all contains a lot amount of phytates, which will be inhibiting the absorption of vitamin D3. So better to avoid any other snacks like with cereals along with this buttermilk and all. And again, it's advised to give soup, especially if they are of non-vegetarian. It's advised to give chicken soup and all. Fish is also a rich source of vitamin D and calcium. And otherwise, vegetables like drumstick, potatoes, tomato and all, guava contains a rich amount of vitamin D. And again, another vitamin D rich food is Krishna Tila. Sesame seeds. Sesame seeds is the highest source of vitamin D directly from the diet. So I think that's why in Dandakshayam and Astikshaya and all, it's Krishna Tila Rasayana is told. Dine Dine Krishna Tila Pragunjam Samashnado Shida Jalanupanam. See, it's told that it's not to be mixed with other food items. Samashnado Shida Jalanupanam. So Krishna Tila can be taken as such with cold water, and or else it has been narrated in the context of recurrent respiratory infections and bronchial asthma and all. Chukiliretyadi, it is told in Malayalam literature. Chukili Retyadi means a beautiful combo of this dry ginger powder, then jaggery, and the sesame seeds. Chukili Reti Urachabula, Tat Trigunandu Varatadila. It comes like that. That is, sesame seeds is bit fried in ghee, then mixed with a jaggery, that palm jaggery, and a bit of this dry ginger powder or shundi churna is added in that, and it is made into a bolus. It is very sweet to have it, and so that it's like it can be had as a snacks in between the school studies and all. So it is very rich in vitamin D3, and it is told that it has the capacity to prevent the recurrence of upper respiratory pathologies like Pingalavan, Milia Korea is told in preventing the recurrent episodes of cough and asthma, it is told. So it's a wonderful combo. That is Krishna Tila alone with Shida Jala. Usually kids won't be liking to have that. So it's better to mix this Krishna Tila along with the jaggery. That palm jaggery is much more nice due to increased amount of iron in that palm jaggery, and bit of shundi churna, make into a small bolus. You can have it as a sweet in between. It's a very good amount of very good source of vitamin D. Again, correcting the Agnimandya, and again another important point with Vatakapa Shamana drugs like Ashtachurna, Hinduvajadi Churna, or even because indigestion or lack of appetite is the main feature. The babies won't be having an aptitude to have the food. Aruchi will be a main feature. So usually a bit of Thalisapatradi Churna in between can improve the acne very nicely. Again, Thalisapatradi Vatakam has also very good role in improving the assimilative power, assimilative capacity in kids with rickets. And also ensure that exposure to moderate amount of sunlight, especially during the morning and evening sunlight, is very nice. And make sure that the body is not entirely covered with the dress, especially during the sunlight exposure. And reduce this cereal intake rich in phytates, especially when you are providing a vitamin D rich food, and do everything to preserve the acne. That's a management protocol of vitamin D deficiency. And usually rickets having the full-blown picture with all that bony manifestation require a much more detailed management than this, the before and after result of a rickety baby with the 2-year management. Now, coming to other Shirorogas. And I had a plan to mention about the rickets because it's so prevalent nowadays, and it should be identified even from the presence of head setting itself. And coming to other Shirorogas, it's pediatric dermatology is very scalp is the main region of pediatric dermatology, especially during that newborn period, because usually find a lot of skin manifestation in the face and scalp, especially in the newborn period. So a bit quick sketch through that neonatal dermatological condition. Many are normal skin manifestation, and bit abnormal manifestations are also noted. So owing to that very thinner layer of epidermis in the neonatal period, the skin is very light and the epidermal layer is very light. It's only a thin flake of epidermis, and higher levels of higher degree of epidermal proliferation and desquamation rate is noted in the child, especially in the neonate. That is newer and newer epidermis is getting formed, and all the dead tissues is getting desquamated, and higher transepidermal water loss is there. More like water is getting evaporated and all. The skin is very thin with fewer sebaceous glands and all. So usually skin forms an easy entry through the microbial infections. And another plus point is that skin is very light, and transcutaneous absorption of medications is also very easy. So skin infections or skin manifestations are very, very prevalent in the neonatal period. This is the cradle cap. Usually in Malayalam, we call it as march. That is like crusting of the skin on the scalp. It's a normal finding in almost more than 80% of the neonates, and usually parents will be a bit worried about that increased crusting rate of the skin on the scalp, and it won't be causing any issues. This hair will be getting entangled in that crust. Only cosmetological issues will be there, but parents will be usually worried, and they'll be trying to pull off that crust, and it will leave a raw skin on that, and chance of getting infection of the raw skin is there. So it's better to advise that not to remove that crust as such. You can slowly remove that crust and brush it out when it's getting loose. And some other cases, this crusting of the skin is also associated with a bit of wet or bit of yellowish discharge underneath the crust. When we call it as that, such a condition, we call it as seborrheic dermatitis. Otherwise, it's just a crusting of the skin. It's very normal, but in some cases, the crust will get infected, leaving a raw skin, leaving a pustular or yellowish discharge underneath, which we call it as seborrheic dermatitis. Usually, some yeast, which is normal commensal of the skin, is getting into a villain role, and it's causing that activation and causing this pus discharge. So usually baby won't be having any other issues of fever or anything, but a bit of foul smelling discharge and yellowish color discharge will be coming out. So washing of the scalp with drugs having Kledahara property and Branashodhana property will be very nice. And for that option, Triphala Kshalana is very, Kshalana with Triphala is very nice, or else you can add, if you can add a bit of HT in that and give a Kshalana, it's much more effective then. So repeated or cleaning that scalp with Triphala Kashaya is very effective, especially in case of seborrheic dermatitis. No other internal medicine is needed in that. In severe case of seborrheic dermatitis, we advise Thubana also. But even the Tripalaksha or HT Shalana is enough in managing such conditions. Again, this happens in bit more elder children. I think this case have been narrated in detail, so I am skipping through it. This is another normal condition. Usually the kids under the age of 1 or 2 years parents will be complaining of reduced scalp hair growth in this posterior occipital area. This is very normal, nothing to be worried in that. Usually they will be lying in the occiput and they'll be rolling the head here and there. That's why there is a reduction in the hair growth, nothing to be bothered in that. Just for the sake of the parents' concern, you can give a head application of any oil or a head massage, but it's perfectly normal, nothing to be worried. Actually, it doesn't need a medical advice. Again, coming to other new skin manifestation in the scalp, this is another normal skin manifestation. We call it as Milia. Very normal in kids, and almost 60 to 70% of neonates have this issue after 2 to 3 weeks of delivery. It's called Milia. Usually found around the nose and the lips. That's pearly white. Can see there pearly white deposits. Very benign, small pearly white papules and very small in size, like 1 to 2 millimeter is the cheeks, nose and nasolabial fold. Nasolabial fold is the main area, and especially the forehead in and around the mouth, it will be the, actually it's a self-limiting condition and usually disappear within 2 to 3 weeks. But Milia is the main concern or main complaint which brings a patient, brings a child to our OP. So make them assure that it's a normal condition. But even if it's normal, excessive use of powder and oil will make the milia bit more infected. So it's advise them to use have a proper hygiene, washing with proper good Kshalana with the Kashaya having an anti-infective, antimicrobial property. For that again, Tribala Kashaya is nice, or Nalpamaradik Shalana is also recommended. And avoid the dusting of powder, that is talcum powder, and avoid the use of unwanted creams and lotions on the face to clear up the milia. Keep it clear and hygienic. That's the only recommendation we should give. And Shalana with Tribala Kashaya gives very nice results. Again, a bit more severe condition is Malaria. And due to the blockage of the sweat glands are not actually formed in this neonatal kids. So immature sweat glands and which get blocked is the reason for Malaria. This is having a different presentation. The other Milia was pearly white, and this Malaria, I think you can see that is it is like clear fluid filled. It is not pearly white, it's perfectly fluid filled. You can see like a clear fluid filled, that is it forms completely. It is seen as clusters in and around the neck, face, and all. And you can see that it will rupture in less than 1 day, leaving a small black mark behind. Like small black mark, it's not deep, but a desquamation mark will be the. Again, another concern for the parents for pediatric consultation. Again, another self-limiting condition, nothing to worry about. But again, all the soaps having high level of chemical soaps, detergents, then lotions, powders, everything should be avoided in this Malaria also. And Kshalana with an anti-infective Kashaya is also advised here. Again, our Thaila Kera, better to avoid excess amount of oil in the case of Malaria also. And in the case of Malaria, you should bear in mind that usually we call it as Dettol Malaria. Why? Because it's a habit of parents to wash the clothes with detergents and excess detergents and Dettol. And this, as you all know, this Dettol is a severe skin allergen or skin irritant. And usually the parents, after washing the clothes in this Dettol and all, they won't wash it off. They will dip the cloth in this Dettol, and without even washing out that Dettol, they will dry it in the shade. So this Dettol and all or detergent is a very powerful skin irritant, and this Malaria-like presentation will be triggered with such clothing and all. So this Malaria-like presentation will be exaggerated in areas where this baby's skin is touching this clothes. So advice like that is also should be given. Make sure that even if they are dipping in lotions or detergents or Dettol or everything, make sure that they are again rinsing the cloth in boiled water and drying it in sunlight. And it's also safe that if they are ironing it again, it's much more nice. This another presentation, that's Malaria rubra, that is which we call the prickly heat. Again, it is due to that improper handling of the child. Usually the baby is made to lie on the back, and every time the baby is made to lie on the back, it's not mandatory. You can roll the baby and make him lie on the stomach as well. Otherwise, increased heat on the contact area, especially on the back, especially, and with the skin and with the clothes and the rubber sheet, if they are using, they will be cause Malaria rubra like presentation, and it will be having an erythematous base. That's a differentiating point in Malaria rubra. Here, Pitta Shamana is mandatory. In other cases, just Pranashodhana was in this Malaria rubra, Pitta Shamana Lebana is mandatory. Chandana Lebana is very nice, or HT Lebana is also very nice in managing Malaria rubra. it's better we manage the miliaria rubra in the beginning stage itself. Otherwise, it will worsen to other bit more deeper stages. This is another more, it is not so common as miliaria, but neonatal acne is that is sebaceous gland getting infected, and small acne-like presentation is again which needs much attention from a pediatric desk, which again kshalana and appropriate labana should be given in this management of neonatal acne. That is pustulosis is the cephalic pustulosis. Again, many more than 40 to 50% of neonates will present with erythematous papillopustular lesions with a erythematous halo. As seen, it's a cheek, chin, eyelids are especially affected. As the main culprit is malassezia, which is a commensal in the skin normally, which turns into a villain and get infected. So again, the selection of the drug for the preparation of bathing the baby is very important in prevention of this dermatological condition. So if we are taking care of our snana in a very nice in water processed with anti-infective or antimicrobial drugs or Rakshakna drugs can prevent all the skin manifestation. That's why due to that increased prevalence of skin manifestation in babies, due to the increased chance of Resarekta Dushti, Kerala tradition has a very long list of different tailas and different drugs for bathing the baby. So I think we can have a short discussion about that drugs as well. This is asymptomatic scalp plaque, nothing to be done regarding that. This one is again another asymptomatic normalcy in kids. This Epstein pearl patches, that is small pearl-like patches. Now you can see small pearl-like patches on the alveolar ridges here, and the junction between hard and soft palate. I think you can see a small pearl-like patches. Nothing to worry about that. It's not a pustular patch. It will go off its own. No treatment mandatory in that. Don't try to manage with any Karshana drugs or anything like that. It will go on its own. Again, birthmark is I think we all are familiar with. One more is a salmon patch. Another normalcy in newborn. Salmon patch, we call it as the name of angel kiss. It's usually found in the forehead, like in the V shape and all. It will be found in the as in the first picture. It's actually a dilated capillary networks in the forehead. Any Pitta Shamana Lebana can help in subsiding this salmon patch very easily. If left unmanaged also, it will be subsiding in a period of 1 year. But if you are managing with a Pitta Shamana leba and all, we can help it to subside in 1 or 2 months. That's a salmon patch is usually found in the forehead, and it can be also found in the nape of the neck also. Maybe you won't be having any other complaints regarding that. So, to manage all these pediatric dermatological issues, so what to do? What's the preventive protocol which we should adopt, especially before manifestation of this preventing pediatric dermatological issues, and when to start the bathing, how to bath the baby, which oil should be used, which soap should be used, whether routinely we should dust the powder dusting is advised. Is it healthy? The use of cream and lotion after the bath should it be advised? That's a lot of questions from the parental concern, which we come across in the routine OP. So our advice in this regard is very important. Especially this is the main concern which attracts these newborn, actually new parents to a pediatric desk. So usually തലയിൽ എന്ത് എണ്ണ തേക്കാൻ അല്ലെങ്കിൽ ദേഹത്ത് എന്ത് എണ്ണ തേക്കാൻ എന്ന് ചോദിച്ചിട്ട് ആദ്യം വരാം. So selection of the oil for the scalp and the body is very important. It should be you should be able to advise the appropriate oil for the head and the body, depending upon the dosha dushti or prakriti of the baby. And it's better to avoid soaps having high detergent value. And also, I don't advise the use of kadalama, what you call Bengal gram powder routinely. And if you are advising, make sure that it's washed off very perfectly. And it should be strictly mentioned that dusting of talcum powder and use of cream and lotion after the bathing may be restricted in most of the cases. And the use of cream and lotion can be advised only on the external surface or extensor surface of the legs if there is a dry skin tendency for the baby. Otherwise, applying the cream and lotion on the skin folds, especially on the folds of the neck, folds of the arms and legs, will create a very raw area, very raw erythematous area, which is chance of getting infection in that skin fold will be very much more. And it should be the application of powder, cream and lotion after the bath should be restricted at any cost. And another question is the dusting of powder on the Brachma. തലയിൽ രാസ്നാദിപ്പൊടി ഇടണോ എന്നുള്ള ചോദ്യം വളരെ കോമൺ ആണ്. And which powder to dust? Is there any need to dust a powder on the Brachma? Usually, dusting on the powder on the Brachma will ensure that the Brachma is a bit more dry. You are not supposed to rub the powder on the Brachma. Just a dusting of the powder is enough. Aryogikalpadrima text has advised to dust the powder of Devadaru and Bela. And in another situation, the Acharya has advised to dust the powder of Amalaki, or Amalaki Churna can be used for dusting as well. So you can have 3 or more options like Amalaki Churna dusting, especially in a case where we need a Shida powder for dusting. If the baby's prakriti is much more pitta, if the baby is prone to develop like prickly heat-like manifestation, can use Amalaki Churna for dusting, or else Vada Vritti is there, or it's prone to develop Vada manifestation, you can use Devadaru Churna for dusting. Or else, if Abhishanda is more, the baby is having a blocked nose, baby is finding difficult to suck the breast milk, especially due to blocked nose, I usually advise them to dust. Dust this Karpuravalli leaves, Panikur Kedala, Karpuravalli leaves, which is dried in the shade and powdered. You can keep it in a small box and use it for dusting. It's very effective. So dusting of the powder on the Brachma is very important. It's better to avoid these Tikshna drugs like Rasnadi Churna and all, especially in the younger ages. And I have seen parents dusting Bhasma, then talcum powder, etc. on the scalp. Again, it's not advised. Dusting a powder shouldn't be so fine, especially in these neonates. Can be a bit of coarse powder can be used for dusting. So the selection of Snana Jala, usually Panchavalka Jala is usually used. It is Pitta Shamana and skin protective. Especially the Vada Vriksha Twak is, or leaves of Vada Vriksha is advised to use regularly. And again, Agaru, Chandana, especially in case of Pitta Vritti like prickly heat or manifestation. Bela leaves and Suradaru is advised to be selected when there is some Vada Pradilomada or some birth injury or anything like that. If you need a bit more Vada and Lomana, you can use Bela leaves. Or in the preventive aspect for skin dermatological condition, this Parandi leaves is very nice. Parandi Techila is very nice. Triphala, if Kleda Shamana is mandatory, Triphala is very nice. It's Ruksha Kledahara. Then skin protective, you can use neem leaves as well. Plavinde Eleda Nyat is also used as Vadahara. So again, another question is Shiro Apyega, which oil to use? Unwanted use of medicines, especially in a healthy newborn, is not entertained usually. So if the baby is perfectly healthy, doesn't need any medical support, so it's better to use plain coconut oil or Murchida Kerataila. We call it as virgin coconut oil that is made from the coconut milk, slowly boiled in that virgin coconut oil is prepared, and it's used for Abhyanga on the scalp and the body as well, especially if the baby is under 3 months. And even under the age of 3 years, the use of Kerataila is much more advised, especially in Arogya Kalpadruma. And when the baby crosses the age of 3 years, you can use Tilataila. Kerataila is much more leku and much more pitta shamana than the Tilataila. So usually the kapha vritti in neonates or kids happens due to the association with the Ushna guna of the pitta. So Kerataila, use of Kerataila is very effective in controlling that Ushna guna, and it can prevent the occurrence of Abhishyanda or Kleda in the baby. So I usually recommend Kerataila application in kids under the age of 5 years, for which Lakshadi Kera is very effective in babies having repeated Abhishyanda and all. That is repeated upper respiratory infections or running nose or everything, increased head sweating and all. Lakshadi Kera is very nice. Or Belashukandadi, everything is very nice, which if the heat is much more and you need a Kleda Shamana, Tripaladi can go for Tripaladi Kera and all. But Amataila or use of unprocessed oil is not recommended, especially under the age of 1 year, till the anterior fontanelle is open. Then some birth injury which demands our attention is caput. Caput is not actually a birth injury. It's due to the molding of the head, especially in case of obstructed labor. The head shape will be a bit protruded out. So it will be a concern, especially for parents after that, soon after the delivery. They will say that the head is a bit protruded out. So anything should be applied for, should be used for any oil application for the head and all. Then it's better to use a Taila having a Vata Shamana property, especially in babies having caput. For that, Bella Taila is a very good option. Very nice option. And more than the Abhyanga, I usually advise to do a Piju in babies having caput. It's very effective, and the caput will be managed within a day or two if you are giving a because anticipating or foreseeing and the chance of minor bleeds on the scalp or minor bleeds in intraventricular or intracranial bleeds, I use Vadashamana Taila. That's why Acharyas foreseen such condition and advised to use the Bella Taila soon after delivery. It's very effective. Cephal hematoma is actually a bleed in the cranium, which is an emergency condition, and usually it won't come to our routine OPD, so I am skipping such condition. Again, a case of facial palsy before and after treatment, again a very rare case, so I am skipping. That is Talam. I think Dr. Srikumar had given a good narration of this Talam and all, Shirolabam and all. But again, I too mentioned that importance of Talam. Actually, Shiras should be regarded as actually a route of drug administration. External application of drugs on the fontanelle is having a very good role. It's excellent route of drug administration. The rate of absorption of drugs, if we use it as a talam, is very fast in neonates and especially in the kids under the age of 3 years. So many of the diseases, many of the systemic illness are being managed with external application of drugs on the scalp, as seen in this case of facial palsy. This was the protocol of management which I adopted in the first stage of inflammatory state soon after the delivery. a drug Khanasara was used with Erendathaila and butter for external application on the scalp as well, and the external application on the face, on the exit of facial nerve here. In the second stage of Kapha Avarna was so again Erendathaila and butter was mixed into a colloid solution and used for soft massages and all. Third stage of Kevalavada, then Balamula paste was mixed with milk and butter for external application. So subcutaneous absorption of medication when applied in a colloid form, especially colloid form, is very apt media for enabling the absorption of drugs into the systemic circulation. When used as a thalam and also externally, it will ensure the faster and quicker absorption of the drug. So why Murtha Thaila is very important in neonates and especially in the babies, due to that increased chances of ensuring the bioavailability of the drugs impregnated in the Murtha Thaila is very much more when applied on the anterior fontanelle. That's why many of the diseases having a systemic manifestation can be managed with the proper selection of Murtha Thaila in the neonates. And also in the babies under the age of, at any age it's possible, but under the age of 5 years, it's very nice. Another one more thing to be kept in mind is delayed closure of fontanelle. This is a baby aged 2 years brought to the OPD with complaints of reduced appetite and constipation was the major complaint. The mother was complaining of the baby is passing stools once in only 5 to 6 days. And that was the major complaint. And the baby was on laxative drugs as a part of, they had laxative drugs from the medical store and was giving the laxatives daily. Baby was habituated on that. And on interrogation, it was found that that even the post-facing faces was speaking a lot, but on interrogation, the mother revealed that even if the baby is not passing stools after 5 or 6 days, the stool is not very hard. It's very sticky stools. Sticky stools are always indicator of a hypothyroidism. And again, the coarse faces, sluggish body movements, delayed development, delayed closure of fontanelle, and the reduced appetite. Everything gave an impression of hypothyroidism. It is confirmed by the investigation. So if any baby coming to you with a delayed closure of fontanelle and constipation, bear in mind that constipation can happen also due to hypothyroidism. Hypothyroidism is the most common cause of preventable mental retardation. So if one are diagnosed that this case of hypothyroidism in the younger stages, we could have managed or it could have prevented the mental retardation in that child. And it is so sad to say that the child was diagnosed to have hypothyroidism only at the age of 2, when almost 90% of his neuronal growth had happened already. So early detection of cases with hypothyroidism is very important. The main feature is widely open anterior fontanelle and constipation is the main feature. The baby will be a bit more bulky with a dry skin, sluggish movements, and reduced appetite. Again, a delayed closure of fontanelle will be seen in rickets as well. So another area of concern in pediatric Shiroroga is headache. As Shirashula was dealt in detail by Dr. Balakrishnan sir. So I am not going into detail of Shirashula, just 1 or 2 points in additional, because Shirashula is very prevalent in kids, especially under the age of 15 years. And if a Shirashula is present in a baby under the age of 5 years, you should be very cautious. Usually it will be under the age of 5 years, headache will be associated with some other pathologies, some other serious pathologies. So if a baby complaining of headache, usually they will complain like netti vedana. They won't complain like headache. They will point like if my forehead is paining. complaining of headache under the age of 5 years, it's usually an organic cause. But crossing the age of 7 years, like school going age, it's usually something linked with an emotional distress and all. So acute and recurrent is headache is usually migrainous. Acute and generalized headache throughout the head, it is linked with systemic illness as well. Even anemia can manifest as headache in kids. And acute localized headache is usually linked with otitis media, sinusitis. Sinusitis and all, as everyone is familiar, they will point to, they can point with a finger to an area which is causing headache. And progressive headache means we should be cautious about. It's something linked with space occupying lesions or intracranial bleeds or something like that. And non-progressive chronic headache. Its baby is complaining of headache every morning or evening, which is not progressing with time. Usually a picture of depression and anxiety. And speaking from the child's desk, I should say that these kids are the more vulnerable for emotional disturbances, behavioral abnormalities, and anxiety and depression is very much prevalent in the pediatric population than any age. But unfortunately, being a parents or doctors, we are not regarding their anxiety and depression, and we are not successful in managing or addressing their anxiety. But this pediatric age group is the most vulnerable. They are so anxious for each and everything. They are dependent on us for every need. They are supposed to satisfy the parents. They are supposed to satisfy the teachers, their peers. They are supposed to make everyone happy, or actually they need much more attention and care apart from what we give. So headache is usually manifestation of their attention seeking, or actually they feel the headache. And we usually say that school പോവാതിരിക്കാനുള്ള വേലയല്ലേ, അല്ലെങ്കിൽ homework ചെയ്യാതിരിക്കാനുള്ള വേലയല്ലേ. We usually make it a bad comment on that headache and usually ignore it. But actually that headache is an indicator of I need more care, I need your love, or I need a much more affection, and it should be regarded at any cost. So we have to have a thorough evaluation of the headache, see if a headache is due to any other secondary causes or systemic manifestation, and or else if it's a primary headache, address the anxiety disorders, address the depression behind that, address the adjustment issues with the school, with the peers, with the sibling issues, and all. Do address that. And usually one more point to add on is child migraine is usually different from an adult migraine presentation. Usually the baby will be pale and will appear baby will appear restless or irritable, and usually think of a migrainous headache if the baby is switching off the television, switching off the computer, keeping away from all the screen, and baby is going into a bed and preferring a dark room, especially during his active phases of play and all. Think of a migraine, because he won't be complaining that I'm having photophobia and all. He'll be avoiding that bright light and all. Then think of a migrainous headache. And one more point to add is that migrainous headache can be present. Migraine, it's not migrainous headache. Migraine can present as abdominal migraine in children, which is much more common. And I think abdominal migraine is not a feature in adult, but it's a feature in pediatric population. Baby will be complaining of abdominal pain actually, especially during that headache episodes as well. So it should be regarded also. Again, tension headache. Tension headache due to this emotional stress and all, especially during this COVID time, COVID crisis, this eye strain due to the increased use of this laptop screens and mobiles, and depression and anxiety. Actually, even though they are happy to, they are awaiting the school reopening in that November, but the amount of tension in their mind is very much. They were not following the school, or they were not following the online classes as regularly, as before, and the internal or mental tension or agony or anxiety in the kids is much more, and usually the tendency to make excuses to avoid the school is building up in every nook and corner. So tension headaches associated with such scenario is very prevalent nowadays. We are getting very much number of cases in the OPDs nowadays. So any emotional and behavioral problem can reflect as headache. So again, external application of regarding the subcutaneous absorption of drugs, increased subcutaneous absorption of drugs should be regarded in the management of Shirashula. Also, apart from the systemic management as narrated by the presenters earlier, so I am not going into detail about that, but a bit to add on, especially Vadika Shirashula, this Bala BMRD, that's Bala, Mustarasana and Devadara is a very wonderful combination. It's narrated by Arogya Kalpadruma. That's, I call it by this short form BMRD. That's Bala, M for Musta, R for Rasana, and D for Devadara. That's a wonderful combo for addressing the Vadika manifestations, Bala, Rasana, Devadaru, and Musta. It can be mixed with Stanya and a bit of Mahamasha Taila or any Vadahara Taila upon your choice. Make sure that it's in an emulsion consistency so that the absorption rate is much more triggered. External application or talam with Panchagandha Churna and ghee and stanya is again advised in Paitika Shirashula. Then Manjishta Ranjana or Jadamamsi Churna with Varanaswarasa and ghee in Kapaja Shirashula. Recommended by or advised by Aragya Kalpadrima, and routine practice also, it's very effective. Make sure that colloid, the consistency will ensure much more faster drug availability, bioavailability. Again, nasal obstruction and all causing distress in the baby. Usually a blocked nose is a common complaint in pediatric population. Again, this BMRD, that's Bela, Mustarasana and Devadaru, if you powder and keep it, it can be used as a dusting powder daily. And in case of some issues, you can use it for talam as well. BMRD can be mixed with stanya and kept for use for tala and Paitika Prakriti. It can be used mixed with Villa Sarasa and used for tala and Kabaja Prakriti infants. And in much more older infants, in case of blocked nose and all, it can be mixed with Shigru Sarasa and used for tala. Again, Trikadu Churna and Shigru Sarasa can again used for nasal obstruction and all. So this all. Then one more point to add on is psychiatric comorbidity in children with primary headaches like migraine and tension headache between the age of 6 and 18 years is very much more. So if a baby is presenting you with headache between the age of 6 and 18 years, you should regard the emotional and behavioral disturbed mind behind that headache, and you should be keeping in mind that this baby has more chances to develop a psychiatric comorbidity in later ages. That means headache in a child is usually a reflection of alpasartoda. So regard the headache in a much more different plane in pediatric practice. Thank you. And I think I had a quick sketch on these diseases. So any questions or any queries or any suggestions in this regard is most welcome. And I thank the organizers once again for this golden opportunity.
Thank you so much, ma'am. So like you said, there will be some nice discussion. We'll move on to that. Those who want to ask the questions directly, please remember to use the hand raising option and then wait for the host to unmute you. Otherwise, you can type your questions in the chat box.
Namita, shall I answer? Some questions
Yes,
are that.
ma'am. Sure.
Head bath, Dr. Ashwini has asked, Dr. Head bath, hot or cold, how is affect the babies, which is good. Actually, the temperature of water for the head bath should be decided depending upon the climate, the any clinical condition of the baby and the prakriti of the baby. So if it's very hot climate, again you shouldn't advise for a bath in like very hot water. Usually a lukewarm bath in a lukewarm water is advised. And usually bath in cold water is not advised for the babies. Why? Because in babies under the age of 6 months, the fat deposit, that brown fat is very much less. So the thermal adjustment mechanism is very weak. So temperature regulate, they are finding very difficult to adjust the temperature. So bathing in cold water is not advised under the age of 6 months. Better use a water in the room temperature, or it's very nice to use if your water in a lukewarm temperature. So the circulation and everything is much more better, and the thermal regulation is better. And applying the oil before bath. Many studies have proved that the application of oil or oil massage for a period of 5 to 10 minutes daily before bath has proven to increase that neuronal axis development, the dermatological preventive aspects in the baby. And also the immunological status of the baby is much more better in babies who are having baby oil massage before a baby bath. But nowadays I have seen many doctors, many allopathic doctors speaking against the baby bath or oil application in a baby. Actually, you can see a lot of studies in the PubMed and all, which is advising the baby bath. But the selection of the oil, selection of the medicated oil is very important. And many like unprofessional ladies are like misusing the name of Ayurveda, like they are using that baby or abhyanga in a very crude form. That's not actually advised. A soothing baby body abhyanga before the baby bath, and baby bath in a lukewarm temperature is preferred always. Yeah. Dr. Sridevi, ma'am, premature graying in kids under the age of 10, what all things to take care? Usually premature graying in the graying of hair is usually familial disposition, but premature age graying under the age of 10 is usually associated with vitamin deficiencies and usually associated with anemia as well. So, or scalp diseases can also contribute in the premature graying of hair. So think about that vitamin deficiency, any other signs of vitamin deficiencies like white patches on the face. Think about hemoglobin level. Think about the acne mandya, especially in kids having Paithika Prakriti associated with Paithika acne mandya. I have seen the association of premature graying in such kids, especially after an episode of infection and all. I have seen the premature graying in, especially in these kids. So correcting the acne mandya first, especially correction of acne mandya, you should bear in mind that which dosha is predominant, where it is, whether it is kabacha acne mandya or paithika acne mandya, it should be addressed in that level. And then if the acne is corrected, the ability of the baby to assimilate the vitamins in the food will be ensured, and no need of further vitamin supplements. Better to check for the diet of the baby and adjust the nutrient components in that. Usually during that weaning stage and all, the parents are habituated to give the cereals alone. So check the diet schedule, especially under the age of 10 years. At this age, they'll be habituated to more junk food with biscuits and all. So keep a strict track of the diet, make necessary advices there are there, and correct the acne, and then only advise for a thyla which is having a bit more nutritive capacity. It's not head application of oil alone is not the correct way. Think for the reason behind this premature graying, correct the acne, correct the nutritional status, then improve that, then have an advice for local application. Am I clear, Dr. Sridevi? Best thyla for...
Yes, ma'am. Thank you. Thank you.
Okay, thank you. Best thyla for hair growing and thickening. Usually that growth of the hair and thickness of the hair, usually the growth of the hair is usually genetic. It's having a very good genetic disposition. So the amount of hair or scalp hair, everything depends upon the parental pattern. And if you're having a very good nutritious environment and enough exercise is very much linked with the hair growth. Usually I have seen the many adolescent girls having a lack of exercise, reporting with conditions of increased hair fall. So increasing the circulation or increasing that scalp circulation is very important. So I usually advise them to have a regular exercise schedule apart from that diet and all, and then add on the thyla for which is complementing the hair growth. If the child is having kabaja disposition or kaba dominant stage like kaba prakriti and all, usually Shida thylas are contraindicated. Like it's usually a tendency from the public to use thylas like Nili Bringadi and all, which is much more Shida. So I usually restrict in using such Shida thylas in kabaja dominant, and for that Kayonyadi or Pujagaladadi is usually advised, while in kids having more Paithika Prakriti and all, I advise a bit more Shida thyla like this Nili Bringadi can be advised, or a Belahadadi is even much more better, or Shirabala is very effective in controlling that hair fall and all. I have seen very good results with Shirabala external application. If you apply kanji water for thickening, is it good or bad? It's a good cleanser. Apart from that, I don't feel that it's having an additional benefit. I usually ask them to wash the hair. If you can avoid the use of chemical soaps, it's usually advised to wash the hair once or twice a week with kanji water. It's also okay. With amalaka kashayam, it's nice. Even with tea decoction, it's nice. Kanji water is good, but bear in mind that it is very Shida. So if that child can accommodate that Shida property, it's okay. Again, another question from Dr. Rekha. Ma'am, a baby of 2 years, 4 months, anterior fontanelle not fused completely. Oh my God. His vitamin D level is 26.9, calcium is 10.3, TSH is 3.16, no noticeable abnormalities in extremities, dental caries of upper jaw present, very active baby. Ma'am, what may be the reason, how to address this case? Anterior fontanelle open at the age of 2.5 is a pathology condition for sure. Vitamin D deficiency, make sure that the baby is supplemented with vitamin now. Under 30 is usually reduced. The upper limit, vitamin D3 below the level of 30. 30 to 70 is the normal level. Below 30 is reduced. But even the level of 26.9 is not a very severe reduction. It's not the sole cause behind this open fontanelle at the age of 2.5 years. So make sure that if the baby is supplemented with vitamin D3 recently, TSH is 3.16, it's okay, it's normal. Serum calcium, we cannot detect a vitamin D deficiency or rickets from the serum calcium. 10.3, it's normal. No noticeable abnormalities in the extremities. See if the head circumference is also normal. From your nothing is abnormal, but it's at the fontanelle should have been closed before the age of 2 at any cost. So if it's open at the age of 2.5 months, it's not normal. But I think you should have a detailed evaluation of the case. Dr. Anju has asked, ma'am, is it necessary to do the dusting of Brachma after bath in normal children? I usually advise a routine dusting of powder of the Brachma even in normal kids. Because it can ensure, especially normal kids under the age of 2 months, I make it sure. It's not mandatory, but it's chance of morbidity or disease status is very much low if you use the powder for dusting the Brachma in normal kids. I usually advise, but I have seen kids without dusting the powder on the Brachma being healthy. I have seen. It's not mandatory, but it's always advised. But selection of the powder depends upon the condition of the baby. You can use powders like I usually Karpuravalli Churna or bit more like inert powders like Amalaki Churna can be used for dusting as well. But it ensures that the water is not getting or that Kleda Bhava is the chance of increased Kleda is being curtailed by that application of dusting powder. So I usually advise in my clinical practice. Oh, apart that continuation of that question, ma'am's baby is still on vitamin D drops, 1 ml daily. So vitamin D drops is usually drop vitamin is 400 milligram per ml. So even when the baby is on vitamin D drops, his vitamin D level is only 26, means he is unable to utilize that vitamin D which you are giving. Assimilation of vitamin D is defective. Better to have an expert consultation and have a discussion regarding this open area fontanelle. Chance of it linked with that vitamin D assimilation is very much more. Better to have a expert clinical evaluation, doctor.
Okay, doctor. Okay, doctor. Thank you.
Okay. Dr. Nikhila has asked, ma'am, is it important that sharpening of head of child during bath? It's not mandatory. Usually, thala uruttiyaga kulipikkarundu. Angane thala urutti namakku head inde shape kondu varanonnum pattathilla. Angane mold cheydedukkanonnum pattathilla. But usually defective head shape is a reflection of the impaired neurological axis. Plagiocephaly, then flattened occiput, everything speaks a lot. You cannot shape the head, but baby lying in the same posture always can cause a defective head shape. I have seen in cases with torticollis condition during the birth injury, bleed can happen into the sternocleidomastoid muscle. This sternocleidomastoid muscle is an ensheathed muscle. This muscle is completely covered with a sheath. So any small bleed, especially during this vacuum suction, force of delivery and all, small bleeds can happen into this sternocleidomastoid muscle, and these small bleeds can get encapsulated into this sheath and it gets calcified. The baby will be experiencing a pain in turning the head soon after birth. So baby, what will the baby do? Baby will restrict the movement of this muscle and keep the head tilted like this. Tilted like this, and we call the condition a torticollis. So what will the baby do? The baby will be lying every time on this side of the head. Baby will be reluctant to turn the head. Such babies, I was seeing the flattening of the occiput on that side, which again we cannot manipulate it with the Abhyanga, Shiro Abhyanga or anything. Correction of the torticollis and making the baby lie in different position is advised in that. We can't shape the head actually. We can shape the head, especially with the application of Shiro, Pichu and all, we can shape the head. But Shiro, Abhyanga and shaping the head during bathing, actually it won't happen. Dr. Sridevi, oil massage before sun bath, do it have positive effect on increased vitamin D absorption? Usually, again, one thing to add more is that babies, they don't actually oil massage and keeping the baby as such for long hours, I don't entertain. Oil massage is to be done as a massage continuous process, and we are not supposed to keep the baby idle after an oil massage. Chance of kapavritti, it's more. So after an oil massage, baby is supposed to have an hot water bath soon after that. And exposing the baby to sun bath after that, I usually don't. I haven't advised in such a way. I don't feel that it's effective as well. If anyone can comment upon that, it's most welcome. Oil bath, oil massage and sun. That's the I haven't done. And I am that. Dr. Sridevi, do you feel that it's helpful?
No, I just asked because vitamin D absorption, I have read that when the fat tissue areas are more exposed during that 6 to 8 a.m. time, the vitamin D absorption is more.
Yeah, it's more.
Rather than
time.
Yeah. So I just asked. I remember that I read like that somewhere, but I just asked for that authenticity and clarity, ma'am.
I'll have a reference about that, Dr. Sridevi, and I will let you know the next day itself. Because vitamin is from the dietary vitamin, then it has to convert into that D3 from the liver, and the renal conversion is also there. Nothing to do with this skin fat and all. I'm not sure, but I will have a reference and will let you know the next day itself. It's a nice question.
Thank you, ma'am. Thank you. Thank you.
Thank you. Is there any month as per Ayurveda to cut hair for first time? Nothing. Dr. Nikhila, nothing. Many samskaras like Chudakarna is all told in many other texts, but different texts like Arthashastra and all, many samskaras have been told. But Ayurveda acharyas were very selective to pick that samskara which is having a medical relevance into our classical literature. All the samskaras told in other texts were not adopted. Like samskaras like Phalaprashana, Annaprashana, and Nishkramana, everything. Nishkramana, I think it's not told elsewhere. It's the creation of our acharyas. Or Phalaprashana, not told elsewhere in other texts. It's a creation of our acharyas for creating a public or social awareness regarding the introduction of fruits and all. But regarding the cutting of hair, Chudakarana Samskara is told in, and I'm not sure which text it is told, but it's not adopted into any medical treatise. So I don't feel it's having any importance to do a Chudakarana at the age of 1 year or at any specific age. Please share thoughts on melanin deficiency in kids. Usually modern doctors give melanin supplement in case of premature graying. Melanin deficiency, especially in premature graying, systemic approach is always better than supplementing with something which over the counter. So I usually advise in premature graying, it's usually linked with the Pitta Dushti. So I usually, Pitta Kapha Dushti is over there. So I usually advise Kritas and Kashayas. Ayurveda Mahadatta Krita has shown very nice results in premature graying management. Snehabana with that, and have a strict check on the diet. Restrict that unwanted diet. Then if he's having excess of emotional tensions or something like that, have a control over that. Advise to have a ventilation over that. And in such emotional disturbances and all, especially regarding the premature healing, if the baby is worried over that, I do add on some Methya drugs which is having Pitta Shamana property. Along with that, usually I add FT Churna or Shankupushpi Churna is very effective in controlling that emotional outbursts or emotional tensions over that. And then application of drugs or oils and medicated paste on the scalp can also help in improving that premature graying. Again, one more thing to add on is controlled exercises, and yoga therapy is also found to be very effective in managing. Actually, I have seen patients, or I have come across patients I am giving who are on melanin supplements, but I think our treatment can work much more effective in this axis. A systemic management of such condition can give much more results. When can we use Rasnadi Churna, or what about Kachuradi Churna? The condition of using Rasnadi and Kachuradi is entirely different. Rasnadi is much more a Tikshna drug. So if the baby, it's not the baby, Rasnadi Churna is very Tikshna. So make sure that anterior fontanelle has closed and baby has crossed the age of 5 years, then Rasnadi Churna I can advise. Kachuradi is more Pitta Shamana, and if the baby is of Pitta Prakriti or such like that, Kachuradi Churna is much more effective. But Rasnadi, it's not advised to having younger kids. Actually, Kachuradi is very expensive. Very expensive drug. So I should think twice in advising Kachuradi Churna as a regular practice. So in Swastha and all, I don't use it regularly. A bit of Amalaki Churna is also enough. Rasnadi, I think it's available in market, is very cheap, and it's a social custom to have a Rasnadi after bath. as it's a Kapakala and all, in age, if age is above 4 to 5 years, the application of Rasnadi Churna is very nice, especially after the bathing. Which is the best time for sun exposure. Morning sunlight is very much healthy, and evening sunlight is also okay, but morning sunlight is much more healthier. Balakiranam is always advised more than this bright sun. Ma'am, will you please comment on this growth pain? Growth pain, actually, we call it like a aching pain. It's very common complaint in children. I think if you take a group of 100 kids, mostly more than 30 to 40 kids in this group will be complaining of growing pain. That is after a strenuous physical exercise, like playing and all, evening time, after the 6 o'clock or 7 o'clock, they will be feeling an aching pain, especially on the calf muscle or the shin bone and all. And they will be asking help of the mother to have a pressure massage. That it will be relieved with a pressure massage. It will be coming down. In severe cases of this growing pain, we can see muscle cramps as well. It's usually told that it's a pain of the growing bone. That means the bone is not having the enough amount of vitamins and calcium for the growth, so it's having a growing pain. Or it's a deposit of the lactic acid accumulating in the bone with the sternus, in the muscle with the sternus exercise. But it's not supposed to have an accumulation with the normal or sternus exercise. So any Vata Shamana Taila with this Svedana can relieve the growing pain in an acute condition, but in a long-term condition, Agni Deepana and proper Sneha Sveda is mandate. Any Vata Shamana Taila and Svedana is very helpful in to subsiding the growing pain. Kannanda. I think Namita, we have finished with the doubts. Anything else?
If anybody wants to ask the question directly, please use the hand raising option. Okay, Miss, we have got one more question right now.
Yeah, post-COVID joint pain in childs, 13 years, how to approach. Post-COVID joint pain is usually a severe level of shosha is happening in the body after the COVID. So all the resources, body vitamin and energy resources are being spent to defeat or combat the infection in the baby. So usually post-COVID joint pain should be regarded, or it should be managed in the protocol of JRA, Juvenile Rheumatoid Arthritis Protocol. And make sure that the Agni Deepti is there and the vitamin supplementation is very nice. Post-COVID joint pain is usually easily managed within a period of 1 or 2 weeks. Nothing to worry about that, but make sure that the food is nutritious and Agni is clear.
So if anybody wants to ask,
may I ask one more?
Sure, doctor.
Ma'am, usually the diet history in recent times, the kids show affinity towards eating raw vegetables as such, especially carrots and all. Hello,
Yeah.
am I audible?
Yeah, I can hear. Sridhari, carry on.
And all those kids are having Agni Madhya and creamy presentations are seen more. Do you think eating raw eating carrots, the parents think, yeah, it's very good, and they promote that habit?
Yeah. Yeah.
Does it come away in interference with this vitamin absorption and all?
It doesn't actually, we should see it in a different perspective, Dr. Sridevi. The craving to have something like raw vegetables is usually seen. It's not always seen. It's usually seen when associated with creamy and acne mandya. And actually, pica is not defined like that. Pica is a tendency to have non-edible food. But this is not non-edible. But as you have observed, I have also observed that tendency to have a raw, to eat raw vegetables, like crunchy vegetables, is usually seen in kids associated with acne mandya. But this eating a raw carrot is not directly linked or not directly causing acne mandya. Even though carrot is heavy to digest, carrot is the heaviest or the most guru vegetable available in the market now. But the consumption of carrot alone won't cause acne mandya. But acne mandya can lead to a tendency to have such food, and you can correct it like with any acne deepana drug like Ashtachurna can be used. I use in such conditions, I use Vidanga powder, have an equal quantity of Vidanga powder along with Ashtachurna and have it before diet. It can manage it. And along with that,
so just like the phytage.
Pardon?
Just like that phytage interfering with vitamin D, vitamin absorption.
Yeah.
Like that, this increased fiber content coming in between that vitamin absorption. Does it have a role?
It's not the fiber content alone. That's carrot is actually very guru to digest. So consuming more guru ahara can cause impair the absorption of other vitamins which is available in the food. So if we couple a bit more lekhu and aknidipana ahara along with that carrot, regarding the craving of the child for that carrot, we can ensure that the vitamins are better absorbed. Takra is the best option for that. I usually advise my patients or my kids to avoid the use of milk in daily routine and to advise the use of buttermilk instead for that. So you can ensure the availability of all that vitamins and nutrients in the milk and in bit more fortified form in the buttermilk, and it will the buttermilk is very nice for this present, like for combating or maintaining the acne in this present scenario. So even though Paya is advised for regular use, I don't advise my kids to have regular intake of milk, especially during the morning hours and evening hours. That is usually the parents give a cup of milk before going to school, and in the evening after finishing that heavy lunch or so, heavy dinner, that I will strictly restrict. So have a buttermilk instead, or have a bottle of buttermilk while going for the school. You can have it in between. It's very nice. You can have, you can see wonders even with an introduction of buttermilk. Like make sure that you add a bit of curry leaves and a bit of ginger in that. I don't advise to add the pachamolak on the adiana samakitilla. Or 3 inchi karvepile. It's very effective in increasing the acne dipti. Even without any other medication, you can ensure that acne dipti. And nutrition, vitamin and nutrient deficiency will be combated with that also. And it's krimihara also. The chance of ensuring that krimihara property is also attained with that.
Okay, ma'am. Thank you so much. Thank you.
Thank you. I think I have seen this Dr. Sridevi in each and every session, and you are very interactive as well. Happy to
Yes,
meet you.
she's one of our most favorite participants.
Thank you,
She's
ma'am.
been supporting us since our first seminar.
Thank you, Namita.
We'll see you again, Dr. Sridevi.
Any external application of heel marks after healing atopic dermatitis? Atopic dermatitis management. Actually, healing marks after a healing of a wound means we didn't do the proper way of wound healing. That's why the healing marks are remaining. Especially atopic dermatitis, the usual sites are the bilateral aspects of bilateral cheeks, then arms and extensor aspect of the legs. If you are giving proper Vrana Shodhana and then followed by Vrana Ropana, healing marks will be usually absent. But in spite of, if you are directly giving without a proper Vrana Shodhana, you are directly giving a Vrana Ropana drug, the chance of having healing marks are very much. For example, I will give it as an example. If the wound is still atopic dermatitis stage, it's having a weeping stage or oozing stage. So, if you are applying oil on the oozing stage itself, Vrana Ropana oils are like Jatyadikera and anything like that, Murivana or else. If you are applying that oil on the weeping stage itself, where Snehana is contraindicated, chances of wound healing is there with an elevated skin margin, leaving a scar behind. If we had gone for a Vrana Shodhana or Shalana with Vrana Shodhana Kashayas and then after wet compresses and all, when the Shobha in and around that atopic dermatitis area had come down and it's a smooth plane and the oozing has come down, and if it has acquired a Sneha Arha condition, and then we had applied an external application of oil along with an internal key support, that healing marks won't be there. Actually, the healing marks are a defective or Ashuddha Chigils, an indicator of an Ashuddha Chigils. I think I am clear. It's not whether it's dry now or no. During the process of healing, how do we approach that condition? It was important. That raised skin margins are indicator of ama in that amatwa in that condition. So if the skin margins are elevated, in especially in an atopic dermatitis with oozy lesions, we should have gone for a Vrana Shodhana, and internal Snehana was much more important than external Vrana Ropana. So if we had backed up with an internal systemic correction, usually it won't leave a healing. I think, Namita, it is over.
Yes. So thank you so much, ma'am, for taking the time to spend with us today. See, everybody was looking forward for your session. That's why I'm sorry you got out of topic questions too. But thank you for answering all that. Even though you've been part of all our seminars, still there are lots of things that we want to learn from you. If we go on, it will extend into the night. So we'll wind up for the day. And I hope that next seminar also you will be there with us to answer all these.
It's a pleasure from my part.
So thank you so much. And thank you to all the participants. The last 8 sessions have been a very good experience, getting to know more participants with each seminar. And we hope that we'll see all of you also again in our next series. We'll keep you updated. So on behalf of Team CAME, I wish you all the best. And thank you so much, ma'am. Please accept our gratitude. And have a very good night, everybody. If you have any more queries about the recordings or about the seminar, please do contact us in our WhatsApp group. Thank you, ma'am. Have a very good night.
Thank you.
Thank you.